So hello guys, how are you? It is the Kulsum Amna Intensive Care Sciences program, and today we will go out for the MS 4 years in general surgery program, and will study this complete course step by step. So let's start the course. So it is the starting of the lecture. It is the starting of the course. Specific learning program, special general surgery specialization areas, and today our main topic is the trauma and the pathophysiology of injury. So let's study the pathology of injury. Involves structural and functional cellular damage caused by trauma, ischemia, or physical agent leading to acute inflammation, cell death, necrosis, apoptosis, or repair. Key mechanism include mechanical disruption, hypoxia, and oxidative stress. It encompasses forensic investigation of wounding, cellular lesion like granulation, tissue formation, and systematic responses like SIRS. So the mechanism include hypoxia, oxidative stress, forensic investigation of wound, cellular lesion, granulation, tissue formation, and systematic responses like SIRS. Core mechanism of injury: mechanical force, blunt force, or sharp force. Incision stabs causes physical destruction of tissues. For example, in this procedure, we will move toward the surgery and will make use of the incision stabs to repair the injury or rebound the healing, rebound the tissues, and repair the changes that results in the damage or the injury. Hypoxia and anemia reduce oxygen, lead to mitochondrial disinfection, ATP depletion, and potential cell death. Chemical, physical agent, radiation, heat, cold, metabolic disruption, diabetes trigger inflammation and repair. Tissue damage trigger an inflammatory response leading to the formation of granulation, tissue and eventually scarring or regeneration. Cellular and tissue pathology: reversible and irreversible cell injury. Cell injury is initially reversible, severe insults, e.g., prolonged ischemia, lead to irreversible damage and cell death. Membrane damage. Types of the injury: soft tissue injury, fracture, organ injury. For example, acute kidney failure, brain trauma, and crush injuries leading to ischemia. Pathological responses: inflammation, repair, and scarring. Inflammation, repair, and scarring, and systematic inflammatory response. Trauma: widespread systematic reaction to significant trauma or infection. Pathology of injury: some problems and new horizons. So we was waiting for the Zan. Let's study the lecture. What is injury in pathology? Cell injury is a variety of changes of stress that a cell suffer due to external as well as internal environmental changes among us due to physical, chemical, infectious, biological, nutritional, or immunological factors. Cell damage can be reversible or irreversible. Pathological injuries, fractures that occur in bone that have become weakened or an underlying condition or disease because the bones are weakened. Even normal activity resulting in minor force being applied to a bone can result in fracture. Pathophysiology of injury and include acute illness and injury recognizes three main factors: infection, trauma, and ischemia. Reperfusion injuries, each of them act by itself or in combination with other two in developing a systematic inflammatory reaction syndrome (SIRS), that is a generalized reaction to a morbid event. Infection. The pathophysiology of acute illness and injury recognizes three main factors: infection, trauma, and ischemia. Reperfusion injury, each of them can act by itself or in combination with other two in developing in a systematic inflammatory reaction syndrome, that is a generalized reaction to a morbid event. Four types of philosophy: general pathology, anatomical pathology, clinical pathology, chemical pathology, genetics, hematology, study of blood, immunology, and microbiology. Four classifications of injuries: minor, moderate, serious, and catastrophic injuries. What are the five classification of injuries? Soft tissues injuries, broken bones, traumatic brain injuries, spinal cord injuries, philosophical injuries. Philosophical injuries or the mechanism of injuries: compact of impact, dynamic workload, overcast structure, vulnerability, inflexibility, muscle imbalance, rapid growth. Four components of pathophysiology are the root cause or origin of medical condition, pathogenesis, the mechanism through which disease or injury progress through the body, clinical manifestation, treatment implications. Four P's of injuries: pain, pallor, pale skin tone, pathresis, numbness, feeling, pulselessness, faint pulse, or paralysis, weakens with movement. Four types of injuries include animal bite, bursaries, burn, dislocation, electrical injuries, fracture, broken bones, sprains, and strain. 15 types of common types of injuries includes the following: pathophysiology, mechanism of history. Blunt injury: injuries that comes in direct contact with blunt object, i.e. something hitting or someone hitting something, can deeper the structural damage such as vascular damage and fractures, and blunt trauma can result in fracture. Tearing of shear forces pressure causes blow Type injuries and cough, counter cough injuries, penetrating injuries. Body surface is breached by an object leveling a bound. Examples include stab wound, gunshot, grasp, burrow wound, as well as patient being implanted and railing object. In general, handguns, shotguns, or hunting rifles are referred to as low velocity weapon. Blunt travel in a straight line where stable injury in a J wave is produced as it passes through tissues, creating tearing injuries can extend further. Crash injuries, burns, blast, acceleration, deceleration. So let's study the mechanism of injury. MECHANIS, mechanism of injury. INJURY, mechanism of injury. So that's all for today. Pathophilosohy eventually later we will study inshallah in the next lecture. So please pray for them for the best and for their best end of their departed souls. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. Oh God, please save us from the punishment of the fire and the punishment of the grave and the severities of the day of judgment. And Allah, inshallah. So that's all for today. Khuda Hafiz.